Thank you, everyone. And first of all, I'd like to thank Chris Cancer for this opportunity and also Alan. The previous speakers obviously made my life easy. So, just to tell them on my lab, I also initiated the Center for Global Oncology. The whole idea is to eradicate disparity in cancer research as well as treatment. However, we contribute to the Center for Tumor Immunotherapy with the Data Science Center and see how we could actually improve response to immunotherapy for various cancers. Again, as I mentioned, the three previous talks made my life easy with four keywords here. One, obviously, the type of treatments, which I think I don't have to introduce again. The second thing is biomarker. Third thing is personalized medicine, and obviously AI. So what I'm going to do in the next few minutes is going to tell you that how AI could really do things which probably we haven't imagined, and that's the power we are seeing currently in our day-to-day life. And can this be extended to the cancer is the question that we are asking. So the question that there were a couple of questions about, can cancer treatment be personalized and can AI help? That's the idea, that's the hope that we are having, and how this could be done is the interest that we have at the ICR. So, as you all know, and already introduced previously, that cancer is highly heterogeneous. That means, for example, even if you take colorectal cancer, actually, patients actually differ in their cancer treatment because of the differences in the genetic makeup of the cancer, as well as because of the patient. So, both of these joined together provide the opportunity to see how we can treat them in the best way. However, because of the lack of information, biomarkers, the current diagnosis is the same for all these patients, and also the treatment goes the same way. That paradigm needs to be changed, and that's what also previous speakers talked about. So that means one size doesn't fit all. That means each individual would differ, or a group of individuals who would differ from each other with same cancer, and they need to be treated differently. So that's where personalized medicine comes into play. Basically, we divide and conquer. We Personalized medicine simply means match patients to their right therapy possible. Here is a hypothetical situation of different treatments, which Alan already introduced few of these already. That means some of these patients, for example, the blue patients in the bottom right corner, are probably having aggressive cancers. In that case, they need intensified combination therapies, maybe more than one, more than two. In that case, obviously, they go through a lot of toxicity. However, as Alan mentioned, chemotherapy, for example, is highly poisonous. That could probably, for cancer, that could probably help them. However, in rare scenario, or in certain cancers, there is a cancer called pancreatic neuroendocrine, which is there's a functional neuroendocrine cancer, which is insulinoma, which is benign, and you can see in the pink ones in the top corner, which probably do not need treatment. In that case, if you treat these patients, they probably succumb to the toxicities and side effects of those treatment. There are other patients who probably need different types of treatment depending on their genetic makeup of the tumor and the individuals. That includes immunotherapy, and Alan again mentioned about the immune deserts and immune hot, we call, which are already having some active immune cells which could potentially respond to the immunotherapy. So how do we do this? Obviously, biomarker. Is it easy to identify biomarker? It's kind of a large field. There are multiple biomarkers out there, but getting them to the clinic is quite challenging. That's what we also do in our lab, and there are biomarkers that can be detected at different levels, from the tumor tissue, from blood, urine, and other means as well. So now even the fluid that's between the individual cells, called interstitial fluid, also serves as a way to identify biomarkers. So however, a robust biomarker needs to identify and tell which of these different subgroup the patient belong to and can be treated such that they can really benefit out of this treatment. And that's where AI comes into play. It's my understanding over the years is that when you look in a reductionist patient from a tumor, because we can only take a small piece of the tumor from, tissue from the tumor, that gives only a bit of information, and defined biomarkers of them would probably not be robust enough. In that case, we need to really look at the holistic picture. Like here, you know, in a blindfolded way, if we try to feel the elephant, obviously we would name the ear as fan and other things, but that's not true. But we need to see this as a whole elephant, and the tumor as a whole is the what we need to really understand. That's where AI comes into play, and the important information here is to collect as much information we needed. And for example, the medical records do exist. We often visit hospital or GP for multiple reasons, and we give blood tests and others laboratory tests which are collected regularly one way or the other. We visit pharmacy for other multiple reasons, and again records are being kept. And again, narrative in the sense, like, GP has a lot of narrative information, and we often underestimated this data, and this is where the AI comes into play. And these medical records over the years for an individual could give an opportunity to really learn, even in some cases prevention. For example, there was a recent publication in pancreatic cancer, which is a really worse cancer, which we work as well, that they found that by mining millions of individuals' medical record, they could find patients who would develop pancreatic cancer over the time. So there is a lot of information that's buried inside. In the last decade, we didn't have that much of analytic and the information to really mine into that, but we have the power. We are developing the power, and thanks to the explosion of the AI. The second thing is a genetic record, that DNA, RNA and protein, and even now the metabolites, which play a major role. We could measure them using a lot of techniques, and Trevor showed this amazing image-based analysis that one could do. We could again take these information, combine them to convert them into digital records, and these digital records are going to play a humongous role. And obviously the challenge is how we're going to manage it, and there are a lot of privacy acts and other things, but that could be managed over the time. And with that large complex data, AI machine learning models are quite important to really take them to the next level, in order to not only integrate them but also understand what that really means. Because AI and ML could be black box, but now we wanted a white box where we can really understand what they really mean, and that's what I will show next slide, that day-to-day life we are using. So once we have the digital record, there will be an opportunity to identify who should be treated with what, and potentially precise treatment, or in even cases where precise prevention could also be done. However, how this is really possible? Is this happening? We are moving towards this. We have enough tools. For example, we are all familiar with Siri, self-driving car, ChatGPT. Siri and ChatGPT provides us information that we need. We ask in a few seconds, it provides us the information that we are asking, and even a descriptive way, or whatever we wanted to play, a song or anything, Siri could do it. Self-driving car, again, provides us an opportunity, still a lot more to improve. However, the self-driving car, the AI, in all these cases, need to understand this as a holistic way. Like elephant, it needs to understand the car. It's not just about the engine or the tires or anything. It has to understand everything, and that is what the power of AI comes in, so that the car can be driven by the AI itself. So similarly, hope it's going to play. So similarly, we are now in the area of artificial intelligence, augmented intelligence, virtual reality. I'm just giving a sense of it, so we can really see the whole picture in front of us with virtual reality, such that we can drive what we really wanted to do over the next years or decades, so that we can find what we can do. That's where the Google DeepMind and others are going. If not competing with that from the academic point of view, at least we can contribute to this, so that we can conquer cancer. So sorry, that's the last slide. But anyway, with this, I think with the AI, we probably could make a difference in the biomedical data collection, mining, as well as the way we could really treat patients or prevent cancer. And hopefully that would happen. And thanks for the opportunity again.